Can you give us a summary of your educational background or your healthcare education?
I didn't go to college, but I did go to school long enough to learn how to read so I can read the data for myself, and that's exactly what I've done.
And for what purpose do you conduct your research and use this brain of yours?
I use it for the purpose of trying to protect children from being castrated and mutilated.
You don't use it to get clicks?
Well, are you using it right now to try to get clicks with this interaction?
You know, if you're going to come before a committee and make mischaracterizations and misrepresentations, it's fair game for us to ask you your educational background.
I kind of have to question your public policy beliefs. And you also stated there'd been no studies. Well, I'm sitting here holding a study from the American Academy of Pediatrics, suicidal disparities between transgender and cisgender adults and children. Before you state things, you may need to know all the facts.
They're throwing facts at him in the state House and Senate in Tennessee as they're debating whether or not to ban gender-affirming care for minors. So I guess the Republicans here in this House invited Matt Walsh in because he's always talking about it. He's quite obsessed with it though. So as he advocates for this whole thing, for underage girls to be impregnated as well, it's one of the reasons why they were asking him, so what are your credentials on all these thoughts about underage folks? What is it that you know? This one particular exchange stuck out to me even more. Watch.
On your blog, at about 16, you're an adult who's mature and can make decisions. You're that at 16. I don't care what anybody says, even going so far as to say when you're 16, you should be married and pregnant. 16 is an adult in your view. Why does this bill have minor defined as 18?
I was a radio host 13, 14 years ago in my early 20s. It's also not an accurate reflection of what I actually said. I was talking about the fact that people tended to marry young historically, and that's all that was about. How does that relate to this?
To all of a sudden act like this phenomenon of girls getting pregnant at a young age that we consider young, 16 or 17, to act like it's a new thing is ridiculous. It's always been that way. Girls between the ages of like 17 and 24 is when they're technically most fertile. Recently, in the last 30 years or so, we decided that's way too young to start a family. So what I'm saying is that the problem is not per se teenage pregnancy, it's unwed pregnancy. That's the problem in society.
Question asked and answered there all in the same clip. He says, I'm not sure what this has to do with going on now. The fact that I was talking about that 20 years ago as a radio host and it was taken out of context. Of course, that's always the line, but immediately goes to Matt Walsh, then talking about just how the problem with society now, not 20 years ago, whenever he was on radio, but now is the problem that these pregnant teenagers are not married. That's the problem. They're supposed to be married by 15 because that whole thing about their anatomy and how they should be having babies as teenagers is actually connected to weddings and marriages, not connected to the impregnating part. Still, who cares? He's just talking. So he also, as he went on Joe Rogan's show, this is another example of his extreme knowledge on the subject, specifically about what's going on with kids and gender affirming care. The numbers are off the charts if you listen to Matt Walsh, but you probably shouldn't because they showed just how wildly incorrect he is. Watch.
How many people have had this done?
Depends on what. I don't think we have exact numbers, but if we're talking about the drugs, it's millions.
You're talking about hormone blockers?
Yeah.
Millions of kids have been on hormone blockers, really?
I'm sure someone's going to fact check me on that, but my guess is that we're into the millions now at this point. Yeah, that would be my guess.
It says over the last 5 years, there were at least 4,780 adolescents who started puberty blockers and had a prior gender dysphoria diagnosis.
This says it's kind of undercounted, but that
would be a big undercounting.
Less than 1,000 people a year.
Yeah.
Yeah, I mean, I would guess, hundreds of thousands at this, but I could be wrong.
Million sounds great.
Yeah, I could be wrong.
Yeah.
The Media Matters will have fun with that clip.
They'd have fun with it because it's truth about what you're about. Miranda, it's almost like as uncomfortable as that Rick Scott clip that we did earlier.
It's hard to top the Rick Scott clip, but if anyone can do it, it's Matt Walsh, and he showed us that he does have that ability. Yeah, I love that his claim that it's taken out of context, and then you give the context, and the context is just as bad as what was taken out of the context. Context didn't help at all. I mean, Matt Walsh is a walking embarrassment, and I'm really glad that multiple people got to spit facts at him on camera for us to see. I think he's used to talking to his audience, which I'm sure, are very simple-minded. He can say whatever he wants and spout whatever fact he wants to spout. And when you talk aggressively and say everything like it's an edgy slam poem, you can probably get those people to believe whatever you have to say. But then you go into real life and you forget that other people have brains and above a 9th grade reading level. And they also have studies that you claim aren't there. And so it was really, it was delightful to see him, get that handed to him.
The thing is, it's not hard to find out the real numbers behind your issue. You could even say, look, I think the number was 3,700, something like that Joe Rogan read to him there. You can even say that's 3,740 too many, Right. But when you start tossing millions, and then after hearing the number of about 3,700, you then go, I would guess it's hundreds of thousands. Well, I guess you continue to guess wrong, bro. It's just an exposure of exactly how the information process works. It's just throw something out there as long as it's scary. Yeah, you could be.
You are wrong. We just gave you the real number. You're wrong.
I have a couple of the real numbers because this is the other part about this. As long as you can act like you're the guy who's this moral, you have the moral compass on protecting children. He's looking to protect children. I don't listen to the Matt Walsh show every day. In fact, I never listen to the show. I wonder, maybe someone can tell me how often he talks about how often children are killed per year in the United States by gun violence, because he's looking to protect children. Let's look at a couple of these numbers. This isn't necessarily that. I looked it up. So from 2020, by the way, the United States is number 1 as far as children dying of firearm deaths. It has surpassed car accidents and other kinds of accidents. In 2020, it was 4,357. That's more than that other number. That's per year. In 2021, it did drop a little bit. According to the New York Times, they point out it's 3,597 children died by gunfire. Weird how that works. Is he talking about that every day? Was he talking about every time we see another school shooting because he's looking to protect children? It's almost like it's not about children. It's about particular things that you want to scare people into believing are true. So you throw the number of millions up there. It would sound worse if I said, you know what, I think about 1 million children die of gun violence every year. And if I'm wrong, and then we look down and we see about 4,000 and then 3,600 the year after, that would sound really weird. But when we hear these numbers for real, yes, 4,000 children dying of gun violence is a problem. And it's not changing. In fact, it fluctuates and it's shooting up as of recent years. Do we care yet? Is it really about the children? Not really getting to look that way.
No, and his definition of children changes anyway. I mean, it's 16 is a child when we're talking about, being able to transition and being able to take hormone blockers. But 16 is not a child when he wants you to get married and get pregnant and start a family. So it's not, he can't even decide what his definition of child is because it changes to fit his needs so constantly.
I'm trying to figure out why though. What does that win? What's the end game? We know why Ron DeSantis is trying to change education in Florida so people don't see the reality of our history. We know stuff like that because they don't want people to be educated. They want the policies to change. They don't want things like that to care. They don't want society to actually see some level of equality. We get that. What's the objective here? He wants more pregnant teenagers? This is weird. How does that fill his happy jar?
It's almost, I can't imagine. And so, yeah, I'm having the same problem you are where it's why? Why do you want this so bad? And one of the only things I can come up with is, well, he's committed to the bit and this is who he is now and he has to defend it. Or, maybe as he gets older, he wants to continue to go after young girls and for himself. And he just wants that to be socially acceptable. And that's the right he's fighting for.
Well, there's some rights in Singapore. I was gonna skip this video, but now since we're asking the question, maybe this is the answer. Watch this, Sat 4.
You seem to have started this, so you have no medical background, correct?
No.
You're trying to address good public policy, correct?
Yes.
I just have to question, some of your public policy. Singapore is able to have nice things in part because they execute drug dealers by hanging and arrest even petty vandals and thieves and beat them with a cane until they bleed. We don't have nice things here because we aren't willing to do what is required to maintain them.
It was a very Donald Trump like tweet, comparing to other countries with brutality and saying why don't we do it? That's the reason why we have a problem. Americans suck.